right, so I'm here with Sara again. Hello, Sara.
Hi, Steve.
And we're going to work on logical levels. And I'm going to show you an exercise that you can do with your client. Now, pay particular attention to this exercise. I recommend doing this exercise with your client in the first session because this is going to establish future sessions with your client. One of the things when it comes to working with clients is the idea of getting them the help they need. That's one idea. The other idea is making sure that they're coming back so you get the help you need, which is your ability to pay your light bill and so forth and have a steady flow of clients. So we never want to have a client come back when they don't need to. If they have a challenge that can be resolved in one session, we go ahead and do that. But as we're going to find out in a moment, logical levels, having a client walk through that, can reveal some challenges that would not be practical to resolve in one session. So if that's the case, now sometimes logical levels, this exercise reveals not much, and we realize that we don't really have much to work with the client, so we do what they need, and that's that, and that's fine, and that's actually wonderful. However, if you're interested in resolving as many of the challenges as the client has and starting with revealing those challenges, this exercise can be great because it's going to reveal to both you and the client in a very obvious way what needs to be worked on. At that point, you can establish a treatment plan. You can say, okay, well, today we have X amount of time, we can work on this. If you want to continue working together, then next week we can work on this. And then if you want to continue after that, the following week we can work on this. And you can set up a plan, which is a treatment plan, but it also allows you to bridge that gap that NLP practitioners come into contact with so often, which is the challenge of having a client come in one time versus having them come in a number of times. Because wouldn't it be nice to have 100 clients and have them all coming in several times if they need it, and then you're always having new clients come in also, so you always have this steady flow. That's part of the practical aspect of becoming an NLP practitioner. You need to make sure that you have clients coming in. So one of the challenges that people tend to tackle early on is getting people in the door. And that's fine. You get people in the door, someone's in the chair, you're working with someone, that's great. But the challenging part becomes what happens after that. How do you get them to come back? Do they need to come back? So this resolves all of that. This tells you if they need to come back. It tells them if they need to come back. It lets you know how many times they need to come back because you're going to see what needs to be done, and you're going to be able to explain to them very clearly, because they'll have gone through the exercise, why you're scheduling other appointments and what you're going to accomplish in those appointments. So let's use logical levels and put it to good use. So what I'd like to do with Sara as the patient is demonstrate this to you. So imagine that we are in the first session. Sara has just come to see me, and I want to find out as much as I can from Sara. You've already got your questions that you can ask your client. Now, dealing with logical levels, we're going to find out even more. So what I would have Sara do, and we're going to sit down for this because it's just not practical for us to stand up and do it, but I want you to realize that it's ideal to have your patient stand up to do this. I'm going to have Sara sit down and just imagine these things in her mind. But when you actually do this, it's a little bit more striking to the patient, a little bit more real to the patient if you have them stand up and actually walk. So I'm going to have Sara imagine that on the floor in front of you are the logical levels. Okay? So you are starting with environment. The first step in your mind forward that you take is environment. And the next step forward you take would be behaviors, and then capabilities, and then the next step forward in your mind that you take will be beliefs, and then identity, and then spirit. Okay?
Mm-hmm.
So you are able to imagine taking these steps forward. And I'll tell you when to take each step, and I'll tell you what happens at each step. I'll remind you that this one's environment, this one's capabilities, and so forth. So you don't have to memorize that.
Okay.
Okay, so that's what we're going to do. But in reality, when you work with your patients in your office, you can have them take steps forward. And if you want, you can have these words written on the floor somehow with cards, or maybe marked off with tape or something that looks professional, and have them step forward, and also have them on the board in front of them. Okay, so you have them on the board in front of them in the hierarchical pyramid, and you also have them laid out in tape before them, or cards before them, sort of walking it.